Standards have a very important role to play in our healthcare system. They set the conditions and the bar, essentially, of what should be in place in order to ensure quality and safety in a variety of different situations. And this particular standard around communication in minority language situations is one that has come into being because of the recognition of the gap and the fact that there were many examples where we knew that there were gaps in care, gaps in consistency, gaps in in what people were doing that influenced ultimately quality and safety of service to patients and families and communities. So by putting a stake in the ground with saying this is the standard, and that standard is developed based on evidence with a distinguished technical committee, with international faculty. By the end of this very rigorous 18-month process, where consensus is reached to say this is the standard, then the challenge is the adoption of the standard in various organizations right across Canada and around the world. And we are also developing assessment methodologies, self-assessment tools that can be used to see how am I progressing toward the standard. Because not everyone will be able to reach the standard at the first pass. It is something that there will be a level of maturity and continuous improvement that will be required to meet the standard. But rather than saying, here's the minimum, we're saying, here's what should be. And then supporting and encouraging people to aspire toward the achievement of that standard.